Greetings. In this video, I'm going to talk about constipation in pregnancy and how to relieve it. Constipation in pregnancy, what causes it and how to relieve it. That's what I want to talk about. But before I continue, I want to plead with you again to please subscribe to my YouTube channel. The name of my YouTube channel is Nigeria Health TV. It's right on your screen. Subscribe to my YouTube channel using the link in my bio, and please help me to get to 1,000 subscribers. I'm begging you. I know some of you have been watching my videos and you have not bothered to check my YouTube channel. Also check there are also interesting content there. Thank you. Now back to the topic. You see, for many pregnant women, one of the major complaints they have is constipation. And what is constipation? Constipation is, I will explain it in lay term. You used to go to toilet once every day, but now you are not going to toilet once in 3 days, or sometimes once in 3 weeks. That's constipation. And constipation can also be in form of stool. Your stool used to be well formed before, normal soft stool, not diarrhea, normal soft stool which you passes. Now your stool is now very hard. That's also constipation. So constipation can be defined in terms of frequency and also in terms of consistency of the stool, if you know what that means. And in pregnancy, constipation is very common. I don't think there's any pregnant woman that don't have issues with constipation. You see, the comments are always like, doctor, you have not said anything about constipation. The last time I went to toilet was 4 days ago and my stool was hard. And what do you think causes this constipation in pregnancy? It is easy and straightforward. It's still that same pregnancy hormone, especially progesterone. Progesterone, you know what it does? It slows down the intestine, it slows it down. It reduces peristalsis. Peristalsis is the movement, is a rhythmic movement in the intestine that helps to move food and waste from the mouth down to the anus. So that's peristalsis. But in pregnancy, peristalsis is reduced. That is the movement of food from the esophagus, from the gut, from the mouth down to the colon, to the intestine and to the anus is drastically reduced because of the progesterone. Progesterone slows down the activity of the gut. It slows it down very well. It slows it down. I don't want to give you out by how much, but it slows it down. And that's why you notice as soon as you take in, the number of times you go to toilet reduces. Your stool becomes very hard. Why does your stool become hard? Because once the food spends so long in your intestine, a lot of water is absorbed from the food. And once that water is absorbed from the food, as it spends longer, the stool will become hard because the water has been absorbed by the intestine. The stool is supposed to, maybe, let's say, now look at it. Food that you are supposed to eat, you swallow, will spend some like 3 hours in your stomach before it gets to your intestine, and to your colon, rectum and anus. The food, and maybe in a total of 6 hours, that food is supposed to get to the anus. When you are pregnant, it can take 24 hours for the food to get to the anus, and even 48 hours, because the activity of the gut, of the intestine, is drastically reduced. That's why you have constipation. For people that be asking, that's why you have constipation. It does not necessarily mean you have any other problem. That's why you have constipation. And now, another reason you may have constipation is because of your diet. You are not used to taking high fiber diet, and also because you are not eating. When you are not eating, when you know eat, you not go shit now. Sorry, you not go toilet now. You not go toilet when you know eat, you not go toilet. So that's how constipation develops. So the constipation you have is because of your pregnancy. No need to worry. And for the fear that those that are scared that will affect their baby, it has nothing to do with your baby. It will not affect your baby in any form. Right? It will not affect your baby in any form. It will not affect your baby. And how do you take care of it? How do you take care of constipation? But before I tell you how to take care of constipation, I want to beg you to don't ever use laxative. Like, I don't want to mention them because I know some of you will now start going to use them. Don't ever use laxative to try and to relieve constipation when you are pregnant. Don't ever. What you just need to do is drink a lot of water, eat a lot of vegetables. You see orange, eat orange. Eat orange, lick, whether it's lick orange now. Eat orange, lick orange, and now eat that one. Then, after you have finished licking the orange, the back of the orange, I don't mean the skin, no. There's a way you peel it and now start eating the inside of the orange. Eat it. It helps relieve constipation. Eat fruit. Eat bananas. Watermelon also helps relieve constipation. Take a lot of watermelon. There's one fruit that is in the season now. Agbalumo, African star apple. Eat agbalumo. Agbalumo is famous for helping to relieve constipation, right? Take agbalumo, it will help you. Eat vegetable, drink water. Drink water, drink a lot of water. A lot of water. Eat high fiber foods. Eat high fiber watermelon, cucumbers, and you'll be fine. And before I go, let me recap. Constipation in pregnancy is normal. Yes, it's normal. You know why? Because it's caused by the pregnancy hormone. It drops your it reduces the activity of your intestine, so that food that would normally take 6 hours to pass through can now take 24 to 48 hours to pass through, and it becomes a problem. And sometimes it can cause tummy ache, I know, and it will not affect your baby. And how do you relieve it? Eat high fiber diet. High fiber diet will do you. Before I go, I want to plead with you again to subscribe to my YouTube channel. The name of my YouTube channel is Nigerian Health TV. Please, if you have been following my content, I want to thank you, but I will thank you more if you subscribe to my YouTube channel. Thank you and bye-bye.